Hello, these are my answers. I wrote them down and I will be reading for my first answer. Understanding our healthcare system is relevant in community psychology because community psychologists are in the role where they can help make or help changes in the healthcare system. The roles allow them the unique opportunity to make a big impact on healthcare throughout the communities in America. It is important to understand the healthcare system because understanding what's offered and available to you will allow the individual to see what's needed for change, if any, which it is needed, or what they want from our healthcare system for the community. Understanding our healthcare system can help to understand what else you may want from your healthcare, what you may not have or is available to you for your healthcare system, and community psychologists can help make that positive change happen. My second question. There are many issues in our healthcare system. I will begin with the high cost of care. The cost for just going to the ER costs just as much as 1 month of rent in Miami, just the ER for a couple hours. Costs stay the same for everyone, whether you have a 6-figure paycheck or make $10 an hour. Different programs for low-income families and individuals are outdated and provide the bare minimum. What that means is that while some healthcare programs allow doctor's visits, or let's say, and the dentist, they may not allow optometrists or gynecologists, or they may not even, most of them do not provide you with that mental health care. They don't provide you with speaking with a therapist or any type of mental health care in the healthcare system. Lost my thought. Okay. Healthcare provided by employers are usually include high deductibles while still taking a large portion of their paycheck. Those that do qualify for low-income programs often must wait on waiting lists because the doctors available that accept that kind of insurance are usually overbooked and underworked. Not every practice, especially private practices or hospital, will accept every type of insurance. They are allowed to choose. It can sometimes lead to discrimination because they don't want certain healthcare programs in their private practices. For my third answer, I am opposed to repealing the Affordable Care Act. The Affordable Care Act was designed to reduce the cost of health insurance coverage for people and families that qualify for it. Unlike most health insurances, the Affordable Care Act helps protect people with pre-existing conditions from discrimination, which just means that people with pre-existing conditions usually would have to pay a lot more or get completely denied for certain healthcare programs based on those pre-existing conditions. The Affordable Care Act, or the ACA, overall makes healthcare more affordable for all. Women who are actually charged more for health care insurance, 1.5 more to be exact, will no longer have to worry about that under the Affordable Care Act. The ACA guarantees fair coverage services that are important to women's health. The ACA also made it easier for young adults to have more access to coverage, allowing for young adults to stay on their parents' coverage until the age of 26, before it was the age of 18. It allows for children to have coverage even if their parents cannot afford it or aren't able to cover themselves. This allows for parents, let's say, who are working those lower paying jobs and they can't afford that health insurance, to allow their children to have that health insurance. The Affordable Care Act The Affordable Care Act even allows prescription medication to be more accessible by requiring Marketplace, which is somewhere you can find insurance plans, to cover at least one drug from each drug class. Thank you.